Okay, so let's start with antibacterials today. And it is a very important topic in this whole pharmacology. The one topic that will just haunt you in the whole pharmacology are like two topics. There are like antibiotics, that is antimicrobials, and the second one that is the ANS. So after this, I will do ANS. So first, let's do antibacterials. A lot of questions are also being asked, and it will be a good integration of both medicine, patho, and everything that we study. So everywhere we have to just know about the antibacterial. So let us start. A patient on metronidazole therapy. Let's see. A patient on metronidazole therapy, isn't it? Okay. So let me get the pen here. Okay. A patient on metronidazole therapy 3 times per day attended a party on weekend and consumed alcohol. Okay, you don't need to see anything else here, just see this. He developed nausea, vomiting, palpitation, flushing episode and headache. Okay, so what is the possible diagnosis? So just break down this question into very short one. That is nothing but he had metronidazole, and now he had alcohol along with the metronidazole, and he developed nausea, vomiting, palpitation. So there is some sort of reaction, and this reaction everybody in the medical world, everybody knows about this reaction, and this is nothing but the disulfiram like reaction. This is the clear cut case of generally the disulfiram reaction. So let's see drugs which causes the disulfiram like reaction. So let's see drugs causing disulfiram like reactions. So the drugs that will be causing disulfiram like reactions are nothing but griseofulvin, metronidazole, cefotetan, cefoperazone, moxalactam, procarbazine, and chloropropamide. So metronidazole here we have in the question is metronidazole, and all these drugs will generally cause the disulfiram like reaction. So just remember, any of these drugs can be given and the symptoms will generally accompany that whatever we have just read in the question. So this will generally go towards disulfiram like reaction. Look, what is disulfiram? We have already just now we saw that disulfiram like reactions will be with the following drugs. There will be palpitations, nausea, vomiting, diarrhea, and everything will be there in the patient. So what is this disulfiram? This disulfiram is a drug which inhibits aldehyde dehydrogenase. You know, aldehyde dehydrogenase in the alcohol metabolism pathway. So generally there will be increase in the acetaldehyde. If disulfiram is a drug which generally inhibits aldehyde dehydrogenase, as a result there will be increase in acetaldehyde, and acetaldehyde is generally a toxic substance. So there will be headache, flushing, nausea, vomiting, abdominal pain, and hypotension will be there. So this is the generally mechanism of how all these generally symptoms are appearing. So you must know about this. This is disulfiram like reaction. Okay, so let's move with the next one. What is the preferred treatment for Plasmodium falciparum malaria? Okay, in the Plasmodium there will be, it is a protozoan, isn't it? So in the Plasmodium there will be like different species of Plasmodium, that will be vivax, falciparum, malaria, and all of those species will be there, and most of the question will be directed toward the Plasmodium falciparum and vivax. So let's see what is the preferred treatment for Plasmodium falciparum malaria. So in the Plasmodium falciparum malaria, generally we give artemisinin combination therapy, that is ACT, artemisinin combination therapy. So let's see what is this ACT. ACT generally means one artemisinin will be there and one will be long acting drug, one long acting drug along with artemisinin. This is called as artemisinin combination therapy. Here you see alone, this artemisinin alone cannot cure as it is short acting and relapse occurs. So just prevent the relapse in the further future, we just use a long acting drug combination with generally artemisinin. So next the question here is oral chloroquine. So oral chloroquine will generally be drug of choice for Plasmodium vivax. It is safe in pregnancy, that is first trimester also, and in the infants also. So you have to know about this. Primaquine, if we talk, primaquine will be generally the single dose for Plasmodium falciparum to kill the gametes, but this will be generally contraindicated in pregnancy. You must remember, primaquine is generally contraindicated in pregnancy. Next thing that we have to see here is quinine. Quinine is generally effective in multi-drug resistant and a multi-drug resistant species, safe in first trimester, and obtained from the bark of cinchona. That can be asked from where it is generally obtained. It is obtained from the bark of cinchona. Here you see drug of choice in cerebral malaria. So some drug of choices in the whole malaria topic, you just see these 3 or 4 lines and that will be enough for it. So drug of choice in the cerebral malaria, that is IV artesunate. Okay, drug of choice in falciparum in first trimester, in the first trimester, that is quinine plus clindamycin. In the second and third trimester for plasmodium falciparum will be ACT, that is artemisinin combined therapy. Okay, so let's move ahead. What is the treatment of choice for echinococcus granulosus? Okay, echinococcus granulosus. So let's see first some of the helminths. Okay, in the parasitology session in microbiology, when we were doing microbiology in the parasitology session, I have already discussed the whole classification there. So I'm not going to do that much here, but I'll just give you a little bit of hint so that you can get about this. So if we talk about the helminths, helminths means nothing but worms that we know from class 11. Helminths means worms, platy, that is means flatworms, and nemat helminths, that means the round worm. So in the platy helminths, drug of choice, just know this much. This much will be enough for solving all the question related to your helminths topic. So let's see. Drug of choice for dog tapeworm. Okay, these all will be generally the platyhelminthes, that is the flatworms I am talking about. Drug of choice for the dog tapeworm will be nothing but albendazole. ठीक है, albendazole will be. Liver fluke, for liver fluke we use triclabendazole, and all other platyhelminthes, any other except these two, any other will be treated by praziquintal. So if you remember this much, this is done for your generally platyhelminthes pharmacology. Next is nemat helminthes. So nemat helminthes, that is roundworms, the drug of choice will be albendazole for all nematodes. See here, albendazole for all nematodes except a filarial worm. Okay, filarial, Ucherodia bancrofti like worms, they will generally, for that we will use diethyl carbamazine, and in the options you will see DEC will be there. We will solve that also. So strongyloids के लिए हम क्या use करेंगे? We will be using ivermectin, that is strongyloids, and oncocerca we will use ivermectin. So this is all about. So ivermectin किसके लिए करना है, albendazole किसके लिए, praziquintal, diethyl carbamazine, that is filariasis, we have already talked. Let's see the next question. A pregnant female in her first trimester presented with plasmodium vivax malaria infection, what will be the preferred drug in this case? So generally ऊपर भी हमने बात किया था, जस्ट टॉक्ड अबाउट दैट है ना, इन द प्रीवियस क्वेश्चन वेयर वी टॉक्ड अबाउट द मलेरिया, एवरीथिंग अबाउट मलेरिया. सो द आंसर हियर विल बी क्विनिन. लुक, दिस क्लोरोक्विन प्लस प्राइमाक्विन, व्हाई वी कांट यूज, बिकॉज दिस इज कॉन्ट्राइंडिकेटेड इन प्रेगनेंसी. आर्टिसुनेट कॉम्बिनेशन थेरापी, इट इज जनरली फॉर प्लाज्मोडियम falciparum we use, but here they are giving plasmodium vivax, and doxycycline again we will not be using this. So here treatment of malaria in pregnancy, let's do it once again. So treatment of malaria in pregnancy for vivax and ovale, ठीक है, vivax and ovale species will use chloroquine. If resistance, if it is resistant to generally chloroquine, or chloroquine is not available, then we can use in the first trimester we can use quinine, and in the second and third trimester we can use ACT. Next for falciparum, the first trimester we can use quinine plus clindamycin, ठीक है, and second and third trimester we will be going with ACT. So this is all about generally the pregnancy cases. A patient was given penicillin and within hours he developed swelling on face and lips. Which of the following hypersensitivity reaction is this? Okay, so before doing this question, let me do a little bit about the pregnancy. What are the drugs that are generally contraindicated in pregnancy? That will be good for you. Okay, so let's see. In the pregnancy, let's see. If the disease is hyperthyroidism, the drug of choice in the first trimester will be polythiouracil, that is PTU. All of us know that. In the second and third trimester, you can use carbimazole and methimazole will be the drug of choice. In the case of hyperthyroidism, in case of pregnancy, I am talking. Which drugs are contraindicated for hyperthyroidism in pregnancy? We can see this. Generally in the first trimester, carbimazole and methimazole will be generally contraindicated, and in the second and third trimester, that is PTU, will be contraindicated. In the anticoagulants, this question has been repeated numerous times. So in anticoagulants, the drug of choice will be generally in the pregnancy, that is heparin will be the drug of choice, that is low molecular weight heparin. In the contraindication in a pregnancy, you cannot use generally warfarin. This is contraindicated in first trimester, 12 weeks tak. Next, in the case of antibiotics, like penicillin, cephalosporin and macrolides will be the drug of choice, like erythromycin and azithromycin will be generally the drug of choice Which drugs will be contraindicated in case of antibiotics? In case of antibiotics, fluoroquinolones will be generally contraindicated because it affects the growing cartilage and tendons in the fetus. Aminoglycosides generally will be avoided, or it is contraindicated because it has ototoxicity and nephrotoxicity. Tetracyclines will be generally avoided, and sulfonamides will generally be avoided. That is, it is contraindicated in case of generally the pregnancy. The next we talk in the case of epilepsy in pregnancy, levetiracetam generally is the drug of choice, and it, if it is not in the option, you can go for lamotrigine. ठीक है. Do not stop anti-epileptic drugs in pregnancy. Never stop anti-epileptic drugs. If the patient is already on generally anti-epileptic drugs and now she is in a pregnant condition, so never stop that drug in generally anti-epileptic drug in the pregnancy condition. So contraindicated, which is contraindicated? Valproate. Valproate is an anti-epileptic drug which is generally contraindicated in pregnancy. If we talk about the bipolar disorder, that is the antipsychotic drugs, if we talk, so generally drug of choice will be antipsychotics and contraindicated will be generally valproate. In the case of hypertension, if we talk about hypertension, okay, why is not working? uh, So in the case of generally hypertension, so hypertension or pre-eclampsia condition, why is it not working? Just give me 1 minute. My pen is not working. This is Desi Jugada. What to do? In the middle of the lecture, the pen is not working. So what can I do? In the case of hypertension, so in the case of look, it's working now. In the case of hypertension, the drug of choice will be labetalol. Everybody knows that in the case of pregnancy, the drug of choice, antihypertensive drug of choice will be labetalol. Hydralazine can be used, methyl dopa can be used, and ccb can be generally calcium channels blocker like nifedipine can be used. But ace inhibitors and arb will generally, ace inhibitors, all of us know that it has pril in the last, and arb will generally have the sartan in the last, so these will be generally contraindicated in the case of pregnancy. The next we talk about some of the teratogenic drugs. Some of the teratogenic drugs that has been repeated numerous times in almost all the examinations, so let's do this. Teratogenic drugs like thalidomide. So this thalidomide is generally a teratogenic drug, and teratogenic means generally it will cause harm to the growing fetus. So this teratogenic drugs like thalidomide generally causes phocomelia, like this will be there, they will have generally short limbs. The children can have short limbs. This is a category X drug. Lithium generally we can't use. Okay, so lithium generally can't be used. It causes Epstein anomaly, cardiac defects. It can be has the, it can have cardiac defects. Ace inhibitors and arb, that is just now we studied, pril and sartan, they have in the last, they will cause renal agenesis if used in generally pregnancy. Carbimazole and methimazole, ठीक है, carbimazole and methimazole can cause aplasia cutis, ठीक है, carbimazole and methimazole will generally cause aplasia cutis. Valproate and methotrexate will cause neural tube defects, and misoprostol can cause Mobius syndrome, that is generally will be affecting the sixth cranial nerves, that is Mobius syndrome will be there due to the misoprostol. So this all you must remember. Now let's move to our question. A patient was given penicillin and within hours he developed swelling on face and limbs. He was given penicillin and within an hour he developed swelling on the face and limbs. Which of the following hypersensitivity reaction is this? So this is nothing but after consumption of a medicine, the person is having certain reactions on his body. So this is nothing but an adverse drug reaction case. So this is ADR type. Which type of reaction is this? This is ADR type B. This already I have talked about different types of adverse drug reactions in the first that general pharmacology session. If you have not seen that video, you can go and just watch that video. So this is nothing but ADR type B, BJR. Okay, B means BJR. Type 1 hypersensitivity reaction, that is IgE mediated, and treatment for this condition will be adrenaline 1:1000. It is diluted in 1:1000, 0.5 ml intramuscular route will be given. So we knew everything about this, but the question is only asking about what type of hypersensitivity reaction. So this is nothing but type 1. Which of the following agent is drug of choice in Legionnaire's disease? Okay, so in the Legionnaire's disease, which will be the drug of choice? So let's see. This erythromycin is nothing but macrolides, isn't it? This tigecycline is nothing but a tetracycline. derivatives. So in this case, so let us see about tigecycline. Tigecycline derivatives, it binds to 30s subunits of the ribosome. It inhibits protein synthesis. It is a bacteriostatic drug. Usage, it is broad spectrum, anaerobic, gram negative, positive coverage, multi-drug resistant organisms like MRSA and VRE will be generally covered by this, and the side effect will be nausea and vomiting. Okay, so here you see erythromycin. Erythromycin is a macrolide. It is protein synthesis inhibitor, that is 50s subunit. It inhibits generally 50s subunits, and the usage of this will be generally atypical pneumonia, STI, gram positive cocci, Bordetella pertussis, and the side effect will be generally the diarrhea. So next question: which of the following antimicrobials is contraindicated in a patient with seizure disorder? So, okay, so in the seizure disorder, which of the following antimicrobials will be generally contraindicated? Let's see: ampicillin, moxifloxacin, imipenem, and cefixime. So, the answer will be imipenem. Here, the drugs contraindicated in patients with seizure. Let's do everything about this at one place. So, in the antibiotics, the drugs which are generally contraindicated in seizures, so that will be imipenem, penicillin, cephalosporin, and metronidazole, along with isoniazid, the anti-tubercular drug. Okay, antihistamines will be contraindicated in a patient with seizure. Antipsychotics, antidepressants like bupropion and tricyclics will be generally there, and baclofen, fentanyl, ketamine, lidocaine, lithium, meperidine, propoxyphene, and theophylline will generally be contraindicated in patients with seizure. Okay, so let's move next. A female patient was treated with clindamycin and developed diarrhea, most probably pseudomembranous colitis. Most probably the pseudomembranous colitis. Which of the following is the likely organism responsible for this? So for the pseudomembranous colitis, look, pseudomembranous colitis, generally there will be Clostridium difficile responsible for this. There will be Clostridium species, that is Clostridium difficile, which will be generally responsible for pseudomembrane generally colitis. If we talk about the Clostridium perfringens, it will cause gas gangrene, that is nothing but myonecrosis. Clostridium tetani will be causing, it produces tetanospasmin and exotoxin causing the tetanus. Clostridium septicum generally. So if we see about the next thing, that is treatment. If we talk about the treatment of pseudomembranous colitis, if there is mild pseudomembranous colitis, we can use metronidazole, and if there is moderate or severe pseudomembranous colitis, we can use fidaxomicin or vancomycin can be used. If we talk about generally the clindamycin, that is protein synthesis 50s inhibitor, it is a bacteriostatic. Just above we just saw this, secreted in bile, safe in renal failure, causes pseudomembranous colitis. So the drugs which can cause pseudomembranous colitis, that is nothing but clindamycin. It is effective against anaerobics also. The usage will be generally for the at the rate cap we can use, that is cocci, anaerobic bacteria, acne vulgaris. The next will be for parasites, that is pneumocystis, malaria, and toxoplasmosis. We can use this. The next is mechanism of action of doxycycline. Mechanism of action of doxycycline. Doxycycline just above we saw in the options also. Generally one question was having generally doxycycline as the options. It is generally a tetracycline. It has 4 cycles. Why we call it as tetracycline? Because it has generally 4 cycles in structures. So generally if we talk about this doxycycline, the doxycycline is a protein synthesis inhibitor, that is 30s inhibitor. It is a 30s subunit inhibitors. DNA gyrase inhibitors will be what? DNA gyrase will be generally inhibited by fluoroquinolones. Cell wall synthesis inhibitors are nothing but beta lactams and vancomycin. And DNA dependent RNA polymerase inhibitor is nothing but rifampicin. You can just remember RNA polymerase inhibitor, that is nothing but R for RNA polymerase inhibitor and R for rifampicin, used as generally a anti-tubercular drug. So if we talk about generally protein synthesis inhibitors, so there will be 2 protein synthesis inhibitors, one acting on the 50s ribosome subunit and one on the 30s ribosomal subunit. So if we talk this chloramphenicol, macrolide, clindamycin, streptogramins, and linezolid, they will be generally working on the 50s ribosomal subunit, and generally aminoglycosides and tetracyclines will be working on the 30s ribosomal subunit. So let's move forward. A 35-year-old sexually active female presented with burning micturition and other symptoms of urinary tract infection. Which fluoroquinolone is least useful in this case? So first of all, we know that fluoroquinolones acts by generally DNA gyrase inhibition. So let's see which fluoroquinolone is least useful in this patient. So the least useful in this patient generally will be moxifloxacin. What will be that? Moxifloxacin. How? Look, Moxifloxacin, it is not excreted via kidney, so generally it is safe in renal failure. It is not effective against UTI. The main thing that we have to, because this burning, micturition and everything, this is generally a symptom of generally urinary tract infection. But this moxifloxacin is not effective against urinary tract infection. It is metabolized via liver. The respiratory fluoroquinol, it can be used as a respiratory fluoroquinolone, and it is effective against anaerobes. Okay, it is effective against anaerobes. If we talk about the levofloxacin, it is the nothing but long acting ofloxacin. So let's see about ofloxacin. So ofloxacin generally it is the respiratory fluoroquinolones, and it can kill any bacteria causing RTI. ठीक है. Ciprofloxacin की बात करें तो generally drug of choice for prophylaxis of meningococcal meningitis, also used for anthrax, and it is used in enteric fever, that is generally typhoid के केस में भी we use generally ciprofloxacin. So if you talk about the different fluoroquinolones which causes hepatotoxicity, they are nothing but provafloxacin, and this drug has been already withdrawn from the market. And the next one is moxifloxacin and pefloxacin. ठीक है, this is hepatotoxic causing damage to liver. The next is the fluoroquinolones causing QT prolongation or torsades de pointis. This is nothing but ofloxacin, moxifloxacin, levofloxacin, sparfloxacin, lomifloxacin, and this lomifloxacin has already been now withdrawn from the market because of its side effects. Next, a female with 20-week pregnancy presents with fever and dysuria. There is fever and there is dysuria. A preliminary diagnosis of cystitis was made. So the diagnosis is cystitis. Which of the following drugs will be safe to use for this patient? The drug that is safe for this patient is generally the patient is 20-week pregnant. So generally ciprofloxacin we can't use, cotrimoxazole can't use, gentamicin we can't use. So generally we will use amoxicillin. This floxacin group of drugs generally are contraindicated in pregnancy. Just now we talk about the different type of the drugs, antimicrobials, which are contraindicated in pregnancy. So this amoxicillin will be good for this patient. Drug of choice for nasal carrier of MRSA. Okay, look. So this methicillin resistant Staphylococcus aureus. So generally in these cases, some drugs of choice will be there, and one drug of choice for nasal carriers they are asking, and only this question has been repeated so many times in the so many examination. So if we see here, this is mupirocin. This is nothing but mupirocin, drug of choice for nasal carriers in MRSA. So okay, if you talk about the mupirocin is generally used for minor skin infections like impetigo, and generally mupirocin will use for different type of skin infections, like अगर कहीं खुजली हो रही है, कुछ हो रही है, तो if we go to the generally of chemist, he will simply give you a mupirocin ointment. So this mupirocin is generally used for minor skin infections like impetigo, also effective against MRSA. So this is the question. Okay, so also effective against MRSA and preferred for nasal carriers, that is intranasal route. From intranasal route you can give this drug, and that's why it is preferred for generally the nasal carriers of MRSA. Mechanism of action for this drug will be it will inhibit staphylococcal isoleucine tRNA synthetase. So this can be asked in examination, in the further examination. So okay, if we talk about the vancomycin, this vancomycin inhibits cell wall mucopeptide formation by binding DLA. Okay, this question DLA. If you have attended Preeti ma'am's lecture, you must have gone through this DLA portion of cell wall precursors. It is bactericidal in nature. It is used for serious gram-positive multi-drug resistant organisms like ES aureus and Clostridium difficile. That is generally Clostridium difficile, which was causing generally pseudomembranous colitis. Toxicity generally red man syndrome. It causes red man syndrome, and there will be diffuse flushing on the face due to this red man, and that's why this syndrome is called as generally red man syndrome. So now I'll have a question for you. So okay, blue baby syndrome. Which drug causes blue baby syndrome? Tell me which drug causes blue baby syndrome. The next one is drug of choice for enterococcus fecalis. Drug of choice for enterococcus fecalis. So generally enterococcus fecalis के लिए generally the drug of choice will be ampicillin. If we talk about the azithromycin, this is nothing but a macrolide used for legionnaire pneumonia. ठीक है, legionnaire pneumonia, chlamydia trachomatis, upper respiratory tract infection, community acquired pneumonia, and typhoid fevers. Tetracycline generally will be used for ampicillin. Ampicillin will be generally used for extended spectrum penicillin. Ampicillin is a extended spectrum penicillin, aminopenicillin, beta lactamase sensitive, and used for gram-positive cocci, that is enterococcus fecalis, E. coli, H. influenza, and Listeria monocytogenes. Which of the following agent is used for meningococcal meningitis in pregnancy? For in the pregnancy, so let's see. Drug of choice for meningococcal disease will be penicillin G. Penicillin G is the drug of choice for meningococcal disease. Drug of choice for meningococcal meningitis is generally ceftriaxone. Drug of choice for prophylaxis of meningococcal meningitis, that is rifampicin. And drug of choice for prophylaxis of H. influenza meningitis, that is rifampicin. Drug of choice for prophylaxis of meningococcal meningitis in pregnancy, that is nothing but ceftriaxone. The drug of choice for listeria is generally ampicillin and just give me a minute. Ceftriaxone is safer than rifampicin during the pregnancy. This you have to remember. So answer will be ceftriaxone. This is safer. True about aminoglycosides. True about aminoglycosides. Generally, it is highly ototoxic. Aminoglycosides are highly ototoxic. So let me give you a brief review of aminoglycosides at one point. It is not effective orally. It is not absorbed. So aminoglycosides are generally not effective orally because they are not absorbed. Effective against gram-negative aerobes and pseudomonas. For pseudomonas infections, we can use aminoglycosides. Not effective for anaerobes. Okay, so it is not effective for anaerobes. It is bactericidal in nature. Nephrotoxicity. It causes nephrotoxicity, that is maximum with neomycin. Ototoxicity, there will be auditory, that is amikacin will be causing auditory ototoxicity, and streptomycin will be causing vestibular ototoxicity. It can cause neuromuscular blockade also, and cochleotoxic, that is amikacin, neomycin and kanamycin will be cochleotoxic. So this generally aminoglycoside. They will not ask you in that much detail, but generally you have to remember ototoxic and nephrotoxic, that is aminoglycoside. Okay, aminoglycosides. If we talk about this 50S inhibitor, that will be nothing but macrolides, clindamycin, linezolid, streptogramin and chloramphenicol. If we talk about 30S inhibitor, that is aminoglycoside, tetracycline and tigecycline with 30S subunit inhibitor. Okay, so let's see. In a pregnant female, which drug is strictly contraindicated? So this is nothing but streptomycin. Just above we have talked about this. Preferred drugs in UTI. Preferred drugs in UTI, that is urinary tract infections. Generally, the most common, the first, let us know about most common cause of UTI. The most common cause of UTI will be E. coli. Generally, the colonies show metallic seen on EMB agar. This you have to correlate with your microbiology. Second leading cause of UTI is generally Staphylococcus saprophyticus. Saprophyticus. So generally preferred drug in UTI will be phosphomycin. Which of the following aminoglycoside is cochleotoxic? Just above we have read about that. That is nothing but kanamycin. Just here we saw about the cochleotoxic. Look, cochleotoxic is amikacin, neomycin and kanamycin. So generally in the option we have kanamycin, I think. Okay, so kanamycin is there. Following antibiotics inhibit cell wall formation except. All of them will be generally inhibiting the cell wall formation except. So this clindamycin, this is nothing but 50S ribosomal subunit, that is protein synthesis inhibitor. These all are generally the cell wall formation inhibitor. Which of the following drug acts at 50S ribosome? So many times you have done this. So this is nothing but 50S ribosome, that will be generally quinipristine, that is generally a streptogramin. Okay, streptogramin. Which of the following penicillins are acid resistant? All of these are acid resistant except कार्बानिसिलिन. ठीक है, कार्बानिसिलिन. सो जनरली एसिड रेसिस्टेंट पेनिसिलिन की मैं बात करूं तो पेनिसिलिन, ऑक्सासिलिन, डाइक्लोक्सासिलिन, क्लोक्सासिलिन, एम्पिसिलिन, एमोक्सिसिलिन, बैकम्पिसिलिन, जनरली टेलम्पिसिलिन. These all are generally acid resistant penicillins. Drug of choice for listeria. Drug of choice for listeria will be generally first line will be ampicillin and second line drugs will be generally trimethoprim sulfomethoxazole. Okay, so ampicillin is here. First line is in the option, so we'll go with this. Chloramphenicol generally is a protein synthesis inhibitor. Which of the following drug can cause gray baby syndrome? So this gray baby syndrome will generally be caused by chloramphenicol. So this chloramphenicol causes gray baby syndrome. It causes gray baby syndrome and bone marrow suppression as the side effects. Clindamycin as the side effect will have pseudomembranous colitis. Tetracyclines we have generally teeth coloration, bone growth suppression, phototoxicity, Fanconi syndrome with expired tetracycline. This question. If we consume generally expired tetracycline, this will generally cause Fanconi syndrome and vestibular dysfunctions will be there. Vancomycin can cause red man or red neck syndrome and it is nephrotoxic and ototoxic. Which of the following antimicrobial agent can result in oto, nephro and red neck syndrome? So just above we have just seen this vancomycin. Vancomycin is used orally for treatment of generally pseudomembranous colitis. So let's see. Vancomycin is never effective against pseudomonas. Drug of choice for pseudomembranous colitis ओरल जनरली मोस्ट कॉमन कॉज दैट इज थर्ड जनरेशन सिफेलोस्पोरिन है ना, वो करता है जनरली, एंड दिस इज द ड्रग ऑफ चॉइस फॉर स्यूडोमेम्ब्रेनस कोलाइटिस. सो स्यूडोमेम्ब्रेनस और स्यूडोमोनास में यहाँ पे यू हैव टू डिफरेंशिएट दिस. इट इज नेवर इफेक्टिव अगेंस्ट स्यूडोमोनास बट इट इज जनरली ड्रग ऑफ चॉइस फॉर स्यूडोमेम्ब्रेनस colitis. Mild case of pseudomembranous colitis, generally we can use metronidazole as a drug. Next, all of the following drugs are used in MRSA infection except that is vancomycin is the drug of choice. Rifampicin can be used, linezolid can be used, but methicillin cannot be used. MRSA is ineffective to generally beta-lactams. Beta-lactams are ineffective to MRSA except fifth generation cephalosporins like ceftaroline and सेप्टोबिपिरोल. ठीक है, सेप्टोबिपिरोल. नेक्स्ट ड्रग ऑफ चॉइस फॉर गोनोरिया. गोनोरिया के लिए ड्रग ऑफ चॉइस विल बी सेफ्ट्राइक्सोन द थर्ड जनरेशन सिफेलोस्पोरिन्स एंड यूज्ड फॉर जनरली बैक्टीरियल मेनिंजाइटिस, टाइफाइड फीवर, कॉम्प्लिकेटेड यूटीआईज एंड एसटीडीज लाइक गोनोरिया. दिस सेफ्ट्राइक्सोन विल बी यूज्ड. इफ वी टॉक अबाउट द गोनोरी, सो लेट्स सी. amoxicillin 3 gram oral or ampicillin 3.5 gram oral for non-penicillinase producing and can be used and first line of management. So the first line of management for gonorrhea will be amoxicillin 3 gram oral or ampicillin 3.5 gram oral. Ceftriaxone 250 milligram IM or cefuroxime 250 mg IM or erythromycin 1 gram oral single dose for penicillinase producing generally gonorrhea. Treatment of choice will be vancomycin plus ceftriaxone. If we combine both these drugs,